If you've got a 50-year-old ex-athlete who's trying to play too hard and do something, and he gets shoulder pain and has a tear in the rotator cuff, how can you tell if it's going to be difficult to treat or to repair or easy?
So we'll usually start by treating that patient conservatively. I'll start with some therapy or maybe a cortisone shot to calm down the inflammation. Then we'll see how the patient does. Now, oftentimes a 50-year-old or even, for that matter, a 80-year-old who's very active, they're probably not going to be happy with a tear. And so most of those patients end up wanting to have their shoulder fixed. And the way we do that is with arthroscopic surgery.
Now, when you say arthroscopic surgery in the shoulder, what do you mean? I've heard of laparoscopic for the belly.
That's right. So arthro is the word for joint, and what it means is we do the surgery on the inside through little small incisions. So it's minimally invasive, and the risks of the surgery are significantly less than with open surgery.
I think it's amazing that you can do arthroscopic shoulder surgery. Can you see the tendons? Can you you know where the tear is going to be?
Absolutely. Yeah, you can see everything so much better arthroscopically than you can open, because you can look in the front and the back and the top and the bottom, and you can move your camera wherever you want to look. And so it's really fascinating, and the technology has completely changed the way we treat the shoulder.
When you're doing arthroscopic surgery, can you tell if it's a good strong tendon that's torn or if it's a muscle that's sort of withering away to begin with?
We sure can, and that's an important part of surgery, because repairing a withered muscle is not really going to help the patient very much. So we want to have nice, healthy tendon that we're going to repair back to the bone. And so we'll take an instrument and we'll grab that tendon and assess the integrity of the tendon during surgery.
Is it usually a muscle, or is it usually a tendon that's torn with rotator cuff?
Typically it's the tendon. It's where the tendon pulls off the bone. That's the most common tear, and thankfully that's the best tear to have, because if you tear in the muscle, sewing muscle together is very difficult, and it's harder to get a good repair of muscle.